Hi, welcome to RG Vision Media. Today on the menu we have
Order up.
How are we equipped here, to handle everything? I mean, we talk about how the number of cases are going up with COVID, some of the healthcare facilities, we need to make sure that we're equipped with beds. Now, are we equipped on the mental health side, for people who are undergoing, certain issues when it comes to mental health because of COVID-19?
Mm-hmm. Well, that's a good question. I know it's important to know the available resources in our community, right, of the Rio Grande Valley. And, I think the university has played a role in adding additional programs in the communities to assist in the shortage of, specialized medical services, especially mental health, right? Like the new UTRGV psychology doctoral program, where we have a clinic here in Edinburgh that established the free warm line, right, for the community undergoing mental health distress during a pandemic. And then we have the regular services that they offer, right? So that, knowing where to go, knowing the resources, there are resources and clinics like that, provide sliding fee scale, that you don't have to have insurance to get help. It's a human need, right? Especially for mental health, right? People need to be aware of where to go and who to call, and because unfortunately sometimes the culture plays a role in seeking services, and sometimes that's to the stigma, right?
Talk about that culture, yeah, because people may
that's something that we have down here too, in the valley.
Yeah, it's like, no, nothing's wrong with you.
Yeah, it's something that not only in our culture down here in South Texas, I mean, it's present everywhere, across cultures, across culturally diverse groups. But down here, we're also unique, and we do see that as a barrier to getting help, with mental health services. And I think education and knowing that it is a medical service that, is available, and, we are offering evidence-based treatments, meaning that these treatments do help.
What about communicating? Or just as far as socializing? That's kind of been taken away from a lot of people, especially those that are still quarantined at home or not working. Would you say that that's affected, people's mental health?
Oh, yes, definitely. I think, the way we communicate and socialize has now extended to different platforms, right?
It's more exhausting, even, I feel.
Correct.
Because
you're
scheduling people on.
Oh, yeah. I've seen patients that have expressed Zoom fatigue, and it's actually a condition now, that has been looked at by, the mental health, field, and Zoom fatigue exists. And now there's more room for meetings, right? Because you're not going anywhere physically, so you might have easier to schedule a meeting at 1, 2, 3, 4, 5, 6, right?
Yeah.
Rather than pre-COVID, we would schedule maybe 1 in the morning, 1 in the afternoon, or a couple during the week, and now we have multiple daily, right?
Yeah.
And that has been happening, and many people are, reporting that, right? So the stress level of work, for those that do have a job, have increased too. Right? Yeah. So Zoom fatigue is real.
No, I've heard.
I mean, I did hear about it. One of my, friends, that they're a teacher, one of the school districts locally, and one of the things they have to do now is to report to the principal. It's to communicate with all their students' parents every week, and that's like a call log.
Yes.
Every day.
I could imagine. Yes. Trying to reach the families, and children,
and let them know, and then the families have questions to the teacher, so it's having the conversations over and over again. But that's
another example of added responsibilities and tasks, right, during a pandemic, So these are all added to what we, didn't know, right?
Yeah.
So that's definitely another factor that is kind of ingredient to that level of anxiety and distress to increase. I think having those shared responsibilities, right? If we have a family unit, if we have two parents, that's like, an environment where if everyone's on the same page, and we are seeing, that shared responsibilities and management of the home, and we that's a prognosis for good coping.
Yeah, because you never thought like how much each parent does until you actually write it down on paper and say, okay, you take care of this, and you take care of this. And given those responsibilities, they can be like, okay.
Even going to the grocery store now.
Yeah.
Now we're negotiating who's going to go this time.
Yeah.
Right.
Yeah.
So something that we never even thought about before.
Right.
And now that's another added thing to our negotiation.
Yeah.
Who's going to the grocery store? Who's gonna everyone's on a hunt for the antibacterial and Clorox wipes and so that's
being strategic when you go.
Exactly. What time during the day?
Yeah.
When are they going to be fully stocked?
Yeah.
What store are you going to go to? You never thought this is a new normal.
Yeah.
And it's an added stressor.
Yeah.
And if we had, as humans we have stressors, but it's just run the risk of creating that or having that anxiety develop.
Yeah.
Or not. Our goal is to make sure to catch it before it becomes a clinical condition.
Yeah.
Right.
So
But we're
that.
human. We're gonna have anxiety
Yeah.
and depression. I would be concerned if you don't.
Yeah.
As a psychologist.
Yeah.
Right? I'm like, okay, I have a patient in front of me. If they're saying I don't have that, I'm like, wait, what do you mean? Right.
Yeah.
We're human. You're gonna have these symptoms and behaviors, but during a global pandemic, things are shifted, right?
Yeah. Well, Juan, thanks for taking the time.
Yeah, thanks for lunch.
Yeah, sorry you only had a
Man, it's
shake.
okay. It's great. It's a good shake too.
Yeah.
It's good to meet you.
Hey guys, thanks for tuning in for this episode of On the Menu with me, Gabe Puente, CEO of RG Vision Publications. For more content about the issue, download the link below, download the RG Vision magazine, learn more about the Rio Grande Valley, and stay tuned for more episodes.